Hello, I'm Dr. Sean Michael Ryder. We often get asked the significance of an MRI in clinic. An MRI in general gives us a much better view of soft tissues, particularly around the spine. We're able to see the spinal cord, we're able to see soft tissue, disc, nerve roots, much better than your traditional CT scan or x-ray. Today we have an MRI that we'll go through. So we have an MRI of the neck or cervical spine and an MRI of the low back or lumbar spine. This particular sequence is very common. We often use it, and fluid is bright. If we start here with the neck or the cervical spine, we can see this dark strip right down the center. That's the actual spinal cord. And this bright fluid, this white fluid around the dark strip, is spinal fluid. Similar here in the low back or lumbar spine, this strip here is the spinal cord. It usually ends around L1 or L2 and finishes its course through the spinal canal as nerve roots. A common source of pain that patients see us for are intervertebral disc. So if we look here at the neck or cervical spine, you can see these bright spots here. These are disc. Similar here in the low back, you can see here, these are very healthy disc. When they're bright and large in size, it's a sign of a good healthy disc. If you look here in the neck, you can see very mild darkening of these discs. Very, very mild degeneration. Wouldn't really be a real source of pain. But as discs degenerate, they become darker and then they begin to collapse. As they collapse, they can lead to pressure on the spinal cord or nerve roots in the neck, and it can also lead to pressure on the nerve roots as they travel down the canal or exit out towards the legs in the low back. Another common diagnosis we see in clinic is a herniated disc or a disc bulge. This patient has no signs of that, but if they were, you would see a bulge going towards the nerve roots or in the neck towards the spinal cord. That in itself can cause issues with pressure on the spinal cord or nerve roots in the neck or the low back. So hopefully this answers some of your questions. If you have any comments, leave them below, and have a nice day.